Lions! Tigers!
And bears!
Oh my! Hi, I'm Dr. Kyson Frank.
And I'm Dr. Craig Farney.
We're the doctors at Docerelife Center.
But today we're here at Sedgwick County Zoo as the Doctors of Oz.
To pull back the curtain on another chronic illness.
Called
Lyme disease.
What is Lyme disease? It is the most common tick-borne illness in the United States. It is most typically caused by a specific type of bacterium called a spirochete that's named Borrelia burgdorferi. And it can cause a myriad of symptoms. It can cause skin problems, it can cause heart problems, it can cause nervous system problems, and it can cause joint problems. How was Lyme disease discovered? It was actually first discovered and diagnosed in the town of Lyme, Connecticut in 1975. But what's interesting is in the early 1900s there was a manifestation of what's called erythema migrans, which is the classic sign of Lyme disease that was seen in Europe. Then, as I said, in 1975 there was an outbreak of what was thought to be juvenile rheumatoid arthritis. In 1982 they actually discovered the bacterium Borrelia burgdorferi in the midgut of the deer tick. And then in 1984 it was found not only in the bloodstream but also in the skin lesions of patients with this condition. The infected tick can transmit the spirochete to the humans or animals it bites. Left untreated, that bacterium will travel through the bloodstream to various organs and establish itself and can create a myriad of symptoms, and some of them are severe. Lyme disease is a multi-system inflammatory disease. First it starts with the skin, spreads from there, it can go to the joints, to the heart, and even to the nervous system. So the most common tick that actually spreads Lyme disease is the deer tick, which is found in north central and northeastern America. But there are also a couple other types of ticks that can spread it as well. You have the Lone Star tick, which is found in Texas, and then you also have the Rocky Mountain tick, which is found obviously in the Rocky Mountains and can not only spread Lyme but also Rocky Mountain spotted fever. So what are the signs and symptoms of Lyme disease? The most common is what's called the bullseye rash, or what's also known as erythema migrans. It occurs within the first 3 to 30 days and can grow up to 12 inches in diameter. Other symptoms include fatigue, fever, chills, body aches, joint pain, and many more. Lyme disease is also the great mimic disease because it's often misdiagnosed as another condition that may have very similar symptomology. Things such as chronic fatigue syndrome or psychological disorders like bipolar disorder, obsessive compulsive disorder, or depression. Things like rheumatoid arthritis, irritable bowel disease, or many more. Another important factor to consider with Lyme disease is other underlying or coexisting conditions that are going on at the time of the infection. The overall summation of burden on the body is an important factor in the severity of the symptoms a person experiences with Lyme disease. Things such as problems with methylation, transsulfuration, acetylation are all common in Lyme disease patients. Some of the factors to consider are things such as mold sensitivities, food sensitivities, chemical sensitivities, how well the body is detoxifying, or do we have a problem with ammonia, do we have any issues with neurologic conditions and other conditions such as that. If you're interested in digging deeper into how Lyme disease started and the etiology of it, here's a couple of references you might consider.